And another statement that we can say confidently is that low T, low testosterone, testosterone deficiency is an independent risk factor for all adverse cardiovascular events.
Correct.
Is that correct?
That's also correct. Yes, Molly Shore is one of these studies that came out of the Seattle VA actually showed that in men who had low testosterone actually died sooner compared to men who did not have low testosterone or normal T levels and they were untreated men. Both cardiovascular mortality and just overall mortality. And so a lot of guys come and ask me, Doc, my testosterone's low. Do you need to treat this or should we just leave it alone? And I have to tell them that study and I have to state that risk, that low T is an independent risk factor for cardiovascular mortality. So do something to increase that T level, right? On your own, if you can lose weight, exercise, sleep better, and improve your habits and increase the T level, then maybe you won't fall into that risk category. But if you're just going to leave that level like this and not do anything about it, you do have a risk of cardiovascular mortality.
That was really important to me when I saw that, because I know testosterone is a performance enhancing drug.
Right.
So they feel better, they look better, they have better sex. But for me, the MD, once I saw that I was changing their health, that I'm putting them from a high risk of heart disease with low T versus a lower risk. So not only do you feel better, look better, and have all this, your health is also better. So cardiovascular disease, we can put that to rest.
Right.
There's no evidence that replacing testosterone therapy increases risk of heart disease.
Right.
Very good.
And prostate.